Let's talk about specifically about bacterial vaginosis. What is it? What happens? If you have not dealt with this condition yet and all of a sudden you have it, you're itching in the vaginal area and you're like, what's going on? You might be freaking out a little bit. Don't worry about it first. Let's try to figure it out. And so what is bacterial vaginosis? So it's an imbalance in the vaginal canal. So for something interrupted the normal pH balance in the vaginal canal, and now you're growing a different type of bacteria. So that's why we call it bacterial vaginosis. And so it's very easy to treat even without a doctor. You can maybe find the creams out there, and the two creams that you have to really look at is called metronidazole and clindamycin. And in my practice, I like to just treat this. This is kind of a disease. It's a nuisance disease. So what the biggest concern that you have with bacterial vaginosis is that it's a fishy, white, clear discharge, usually after sex. So anything that gets introduced into the vaginal canal that can change the pH. Once in a while, it could be food related. And this is not to be confused with a yeast infection. They may present as itchiness, but there's a fishy odor associated with bacterial vaginosis, and it's really related to the pH imbalance. You're like, well, why does that happen after sex? So if you're having unprotected sex, the pH of semen neutralizes the acidic environment of the vaginal canal, and that changes that pH, and therefore different bacteria grow. And so can you really prevent it and so forth? Sure, after having relations, you can clean out, and that should maybe restore it. Over time, it probably would normalize, but it's really an unpleasant experience for the woman. And so get treatment. In my practice, I just like almost make it like an automatic. If you got it, just contact us so we can treat it. I'll see you at the next video. I hope that helps.